that I want to discuss today is maternal mortality or pregnancy-related death. This is defined as death during pregnancy or within 1 year of birth related to a pregnancy complication. There are approximately 700 pregnancy-related deaths in the United States every year. More than 60% of those are preventable and occur in the postpartum period or within 1 year of giving birth. I do believe that there's a solution to this problem. The United States should improve access to healthcare for pregnancy-able people. And there are several reasons why this should happen. Reason number one being that many people in the United States, particularly minorities, do not have the resources necessary to seek the healthcare that is direly needed throughout pregnancy. This includes lack of quality healthcare or having no coverage at all, lack of access to optimal facilities and medications, and even transportation. This lack of access makes it hard for people to get and maintain proper healthcare throughout all stages of pregnancy, which leads me to reason number two. If people were able to properly follow up throughout pregnancy, it could significantly lower the risk of complications. For a healthy pregnancy with little to no complications, understanding one's pre-existing conditions is really important. Certain heart conditions, diabetes, high blood pressure, obesity, and infections are examples of pre-existing conditions that require close attention and follow-up throughout pregnancy. There are also conditions that require immediate recognition, evaluation, and attention. These include hemorrhage or severe bleeding, heart conditions, and mental health issues. And those are some of the most common causes of pregnancy-related death. So we discussed having access, resources, and the importance of following up. However, being able to do so without the concern for cost is just as significant. If people were not worried about the cost, the rate of cure seeking would increase significantly. There are several factors that prevent people from seeking healthcare during pregnancy. These include poverty, racism, distance to healthcare facilities, lack of information, inadequate services, and even cultural practices. It's important to identify and address these barriers so that people can seek care when necessary. Approximately 64% of Americans report delaying or not seeking medical attention because of the cost. Accessible healthcare is the most important first step in addressing this issue. Now, there are some limitations to this solution. Cost is the largest barrier in implementing universal healthcare. There are many developed nations with some form of universal healthcare that are not as populated and diverse as the United States, indicating that it would be financially difficult for us to do the same. However, not implementing comprehensive, affordable health insurance could damage the health and economy of the United States in the future. The bottom line is that maternal mortality in the United States is unacceptably high, and universal healthcare is the first step in addressing this issue, and it should be a priority for the United States.